Hello, and welcome back to the Living with ALS webinar series. I'm Lori McFerrin with the ALS Association. Today, we're happy to be sharing a presentation on all things in-home care. A number of you have been asking for this in your survey responses, and so we found a pretty experienced care services colleague who's going to help us tackle that today. Before we start, though, let me offer my usual reminders. This presentation is being recorded. It will be added to our library of previous webinars on our als.org website. During Katie's presentation, feel free to put your questions or comments in either the Q&A or the chat feature. Katie will get to those questions at the end. We'll have plenty of time for Q&A. Also, during today's presentation, Katie's going to mention a number of resources. We want to make sure that you don't have to spend your time writing them down. So for all of you who are joining us live today, I will email out a list of the resources that are discussed during today's conversation. And for those of you who are maybe watching this webinar recorded and so are watching it later, where you find this webinar on our website, you will also find the list of slides that have all of Katie's resources. So do know that we'll get you the things that she's speaking about. And lastly, before I introduce Katie, I want to remind you we have a really quick 3-question survey at the end of today's presentation. That survey really tells us how we did in meeting the needs around in-home care in today's webinar. But equally as important, it gives us feedback as to what you might like to see as topics that we look at later this year. So please stick around. That survey will come up as soon as you close out today's presentation. It'll come up and remind you to take or to answer those questions. So for the real reason we got together today is to hear from Katie Schauer. Katie, like I said, is a member of our care services team. She happens to be located in Missouri. And part of the role of our care services navigators and care managers is to help folks access resources. In-home care is one of those needs that people have really kind of throughout their ALS journey, and the needs can be different. Sometimes caregivers need respite and you're looking for a short stay. Sometimes you're looking for skilled care, meaning you need, maybe physical therapy or occupational therapy to come in and do kind of a safety evaluation. So Katie's going to touch on all of those and more. Katie, if you're ready, I'm going to hand it over to you.
All right, thanks so much for the introduction, Lori. Hello, everyone. Glad you can join us today. Hopefully you'll get some new information, and at the end we'll have time to answer any questions. And like Lori said, she'll be sending out resources, so that hopefully will be helpful for you. I want to share just a little bit about myself before we get started. I am a care services navigator. I work in the Kansas City area. I'm a licensed social worker, both in Missouri and in Kansas, and I've been working at the ALS Association for about 2.5 years. Before working here, I did have a background in hospice work. I provided social work, I was a bereavement counselor, and I was a team manager. Worked in hospice for about 10 years. Then I do also have a background in behavioral health. And that just tells you a little bit about me. I don't know if you can tell in this picture, but I am wearing my ALS Walk t-shirt here. I know that's an important day for all of us. And I'm so glad to be part of the ALS Association and joining you all today. We do have objectives for today's webinar, and I'm just going to spend a moment going over what those are with you. Today, I'll be describing what the different types of in-home care are. I'll be explaining how each of those types of care are paid for. We'll discuss when different types of in-home care might be needed. I'm going to share some educational materials with you from the ALS Association, and then I'm also going to provide a few additional community resources for you at the end of the presentation. And then we'll also have a little bit of time for questions at the end. Wanted to start off with this handout by the ALS Association. You can find this on our website, als.org. It just gives an overview of 10 things to know so that you can understand what your in-home care options are. The first thing to know is there are different types of care, and those types generally are home health, palliative, hospice, or non-medical care. And the type of care that you choose or that you need depends on what the care objective is. The second thing to know is the types of care may be skilled versus they may be non-medical. Skilled care is something like skilled home health, which refers to medical services that do require a nurse or a therapist, a licensed professional. Non-medical care includes companionship, personal care, and those are the type of activities that do not require a licensed professional typically. One thing to know is that it's helpful to explore your options early. It can be helpful to start thinking about what your options are for help in your home before you get to that point where you need it. Sometimes it can take a little bit of time to find a caregiver and to build a relationship with a caregiver. So sometimes it's helpful to go ahead and start exploring what your care options will be earlier in your process. Fourth thing to know, evaluate your needs. Your doctor is the one who would prescribe something like skilled care. So, for example, home health. Your doctor and therapy care, or your doctor and team rather, would determine any sort of skilled nursing or therapy that you need. It would be up to you, the person with ALS, and your loved one to decide what your non-medical home care needs are going to be. Fifth thing to think about is when you're hiring caregivers. When you are hiring non-medical care, you can use a home care agency, or you can use an individual that you hire privately. When you're using an individual, you typically would interview applicants to find the right person. Sixth thing to know, paying for in-home care. This is a big question for people. Typically, Medicare and commercial health insurance, Medicaid, those typically, all those payer sources do typically cover skilled care. However, non-medical care is usually paid for privately, or it might be covered if you have a long-term care insurance policy that might help cover in-home care. And then Medicaid and the Veterans Administration may help cover in-home care for some eligible individuals. Seventh thing to know is care schedules. Non-medical care can be scheduled for a few days, few hours at a time, or for full days, depending on what your needs are, what your financial situation is, and then how available the caregivers are for various schedules. Eighth thing to think about, caregiver training. If you have a good caregiver, they will be willing to participate in some training to understand a little bit more about ALS and to understand what your specific care needs might be. The ninth thing to know is respite care. It can be helpful to enlist respite care so that your family caregiver gets some rest and so that they have some time to focus on their relationship with you outside of being a caregiver. And then lastly, just keep in mind, let us help you. Your local ALS Association Care Services team is here to help you talk through what your needs are, find out what your resources are in your community, find out what services might be available. And then also the Care Services team can help provide those ALS training tools for caregivers. So that's kind of a good overview of in-home care options. And again, to list these, the four main types of care in your home are home health, palliative care, hospice, and then non-medical care. And we're going to spend some time talking about each of these four types of care. So the first type of care that we're going to talk about is home health, and it is typically ordered by a physician. And the kinds of things that prompt a referral to home health by a physician would be something like a hospital stay, might be a surgery, or sometimes the doctor just realizes that there's a new skilled need and that new need is identified. Before they can refer you for home health, the doctor needs to assess you face to face, and then they would certify that you are homebound and that you qualify for some home health services. One thing I frequently see is that a neurologist will often order home health to evaluate safety in the home and educate about transfers if somebody has had some changes in their mobility. It's important to remember that home health schedules are often limited, and then they are usually the care is directed towards certain goals, such as recovery and functioning. The goal could be something like caregiver training. But home health is not something that's going to be 24-hour care or even multiple hours at a time in your home. The schedules are typically limited. And then to continue getting home health, a physician must certify that you continue to qualify for this kind of care. Who covers home health? Really, all of the payer sources do. Medicare, Medicaid, private insurance or commercial insurance, and then also if somebody is covered through the VA. All of these types of payers do cover home health. The types of care that might be provided through home health would be things including skilled nursing, physical therapy, occupational therapy, speech therapy, and then there also may be medical social services. I listed here a couple of the types of skilled nursing care that would just be examples of things that might be covered. There does have to be a need for a nurse to come out, and some of those skilled needs include things such as wound care, patient and caregiver education. So we talked about like when there's a change in status that you could be referred for home health. Could be for something like IV or nutrition therapy. And again, that's usually for something new, for starting a new type of treatment. And then another skilled nursing care example would be something like an injection. A question that comes up is whether home health aid visits are part of home health. And the answer is that they may be. You may be entitled to some home health aid visits intermittently through the home health agency if at the same time you are also getting a skilled service. And just as a reminder, we kind of already talked about the skilled services, but that would be things like nursing, PT, OT, speech services, that kind of thing. Um, so if you're receiving those skilled services, you might be able to get a home health aide to come out and assist with things like bathing, dressing. And again, this is like a short-term visit rather than round-the-clock care. One of the criteria that I mentioned for home health is that a doctor certifies that you are homebound. And sometimes people wonder what that means because it doesn't mean that you absolutely don't leave your home, but it means that you have trouble leaving home without help. Leaving home isn't necessarily recommended because the condition that someone's in. You might not be strong enough to leave your home except for medical appointments. And just a reminder, it is a condition of eligibility for home health. And that's the only type of care that has that restriction that's provided in the home. Included two websites here where you could learn a little bit more about home health. Medicare.gov has information because that is a question that people have a lot, is whether Medicare is going to cover their home health services. And then I also found a website found an article on the AARP website. And the article is called Does Medicare Cover Home Health Care? So those are a couple of resources for you. The next type of care that we're going to talk about is palliative care. And palliative care, the goal of palliative care is comfort. It is a complementary type of care, so it complements the other types of care that a patient is receiving, and it doesn't provide any restrictions. Receiving palliative care doesn't restrict any of the other type of care that you receive for your ALS diagnosis. Palliative care supports caregivers and loved ones in addition to supporting the patient. And it may be provided as an in-home type of care. And it also might instead be provided as an outpatient service, or it could be provided through telehealth. Here in the Kansas City area, we have a lot of palliative care provided through telehealth appointments. So I include it as in-home care because it might be provided in your home, but just so you know, it may very well not be provided in the home because there are other ways it can be provided. It is usually covered by health insurance, so Medicare, Medicaid, commercial insurance, and the VA do typically cover palliative care. And the goal of palliative care is to improve your quality of life and to help manage any symptoms that are affecting your quality of life. And just a few examples of what those symptoms are that could be managed by palliative care could be things like pain, could include anxiety, depression, cramping, trouble sleeping. There's just multiple types of symptoms that are addressed by palliative care. And it's typically provided by medical professionals that include physicians, nurse practitioners, nurses. There could also be social workers and or chaplains could also be involved. And then some palliative care providers do also have home health aides in certain geographical areas. And palliative care does really seem to vary depending on where you're located. So if you're wondering about palliative care, it's a good thing to ask your doctor about, ask your care services staff member about what the palliative care is that's available in your area. And ALS Association does provide this 10 Things to Know informational sheet, Understanding Palliative Care. And this is on our website, als.org. And it kind of goes through some of the information that we did discuss already, but it's a really good way of putting it all together. As we mentioned, the palliative care is about quality of life. It's an approach towards your care goals, whether you're seeking curative treatment or if you're more focusing on your comfort. Palliative care does relieve suffering. The team works with you to try to help you identify any sources of distress and to get some relief from that suffering. Palliative care helps you share your values. You can communicate what's important to you as the patient. It can help you communicate with your family members, your loved ones, also your care providers, and any healthcare team members. It's a way to express your values to everyone involved with you. It helps you identify what your goals are and then revisit those goals from time to time as they can change. Can help to review your goals regularly so that the care that you're getting best fits whatever your changing needs and desires are for your care. Palliative care is provided by a team, and that does include physicians, nurses, chaplains, social workers, and then it also includes your family and it includes you, the person at the center of it all, the person with ALS. Palliative care number 6 provides support for care partners. It helps make sure that the people in your life feel informed, that they feel cared for, and that they feel supported to help both you and them have a better quality of life. Palliative care is a medical specialty. So the providers have special training. They have expertise in alleviating pain and treating other symptoms. Palliative care is a partnership. This palliative care approach does include informed shared decision making, and it helps build that trust and then help you have open communication. it's a good idea to talk to your team about palliative care. You can talk to, if you receive care at an ALS clinic, ask them about palliative care options. And then also you can talk with your local care services staff member about it as well. And number 10 thing to know about palliative care, it's okay to ask. And there's a lot of topics that are really difficult to bring up. There's topics that are hard to talk about. And it can be really helpful to have a professional help you identify what your concerns are, help you realize what your questions are, and talk them through with a trusted professional. The third main type of home care that we're going to talk about today is hospice care. And hospice care, like palliative care, does emphasize comfort, emphasizes symptom management. Hospice, it becomes your type of care whenever your doctor refers you to hospice care, when your doctor and you together make the decision that it's the right time. The doctor does need to certify that they feel a patient has 6 months or less to live based on their current disease trajectory. And then not only that, but then also that a patient is choosing comfort rather than choosing life-prolonging measures at that point. It can be hard with ALS to predict what the trajectory of the illness is going to be. So a doctor will make their best prognosis that it's reasonable to refer to hospice. However, a lot of people with ALS may remain on hospice care for longer than 6 months. That can be very common because it is hard to know how much time there is available. If you continue to meet the criteria for hospice, it can be extended. So it's not limited to 6 months. It's not limited to a certain amount of time. You can remain on hospice care so long as you're still eligible for it. Once you're on hospice, it does cover your medications, your services, and any of your medical equipment that's related to your ALS. So that's important to know that hospice becomes the type of care that is really managing, that hospice provider is managing your ALS and any of those things related to your ALS. Medicare is covered by all different types of insurance. Hospice is covered by Medicare, by Medicaid, by commercial insurance, and by the VA. So it is typically a covered benefit. And I mentioned that the 6 months prognosis is difficult to determine. So sometimes people really have a question about when should hospice care begin? And really the answer is to talk with your care team, to talk with your doctor and then also your family and loved ones, and just talk about when hospice might be the right choice. Since hospice becomes your primary coverage for your ALS, it is important to time things as far as if you are going to have something like a power wheelchair, for example, or if your speech is affected by your ALS and you're going to need a speech generating device, those would be items that would be important to get before signing up for hospice. So if it seems like that those items are going to be necessary, it's a good idea to talk with your ALS clinic or other providers about a referral and evaluation for both a power wheelchair or for a speech device if needed. Because once you sign on to hospice, those are typically not covered by the hospice. ALS Association does have a nationwide program where we do have loan closets locally with equipment. So if you're feeling like you need hospice care and you don't necessarily feel like you have the time to wait to get some of those items, consult with your local care services staff to see if there's anything that ALS Association can help with. It's also important to know if you're going to get a feeding tube. Sometimes people do opt to get a feeding tube when they have ALS because it can affect your swallowing and your ability to eat and drink. If you are going to get a feeding tube, you should do that before you sign up for hospice. You're fine to be on a feeding tube with hospice, and to, still use it. It's just that you wouldn't be able to initiate getting a feeding tube because that is a surgery. And once you're on hospice, you don't typically go to the hospital. You don't typically have surgeries. So that would be another of those things that would be good to do before going on hospice. You might start thinking about hospice when you meet the criteria. And then also, if you find yourself in the situation where you're needing some of that equipment that's provided, perhaps you're having trouble, getting in and out of bed and turning, and you feel like it would be helpful to be sleeping in a hospital bed. Um, if you need a Hoyer lift for transfers, sometimes that's kind of a sign that maybe once you're needing some of that equipment, hospice could be helpful. And then just if you feel like you need more assistance to remain safely at home, maybe your spouse or other caregiver maybe needs a little bit of help and support to know what to do to help take care of you at home. So those might be times that it would be helpful to think about hospice care. And then people often wonder, what in-home care is covered by hospice. Each person's care plan is unique to their own specific needs, but there are some general services that are usually part of that care plan. There's always a nurse. There's always a nurse case manager, and nurses do visit to help with your symptoms, physical symptoms, and then also emotional ones as well. With hospice, you do typically have access to a home health aide. They'll usually come out anywhere from a couple times a week to maybe more, depending on the hospice. Uh, and that home health aide can help with things like bathing, with personal hygiene. They can help with nail care and stuff like that. Um, like with home health, it is intermittent help. So it's not a home health aide to come stay, for many, many hours or, to provide care around the clock. So it's more of intermittent care where they might come out anywhere from, like I said, a couple times a week to a few times a week. Other disciplines that are part of the hospice team, there are chaplains that can come out and visit if that's something that you're interested in. And then there's always a social worker available as well for emotional support to help with any ideas for resources for you and your loved ones. Some hospices do also have volunteers that might come out and just spend some time with you if that's something that would be helpful. Hospice is typically provided in the home, but I do mention that there is a benefit with hospice called respite, and that doesn't include a very short-term stay in a nursing facility. And then some hospices may also offer an inpatient level of care if somebody's needing it for symptom management. It's usually a real short-term inpatient level of care, but those are both parts of hospice care that are not necessarily in the home. Included a little bit of information about hospice here. There's a website, caringinfo.org, which is a program of the National Alliance for Care at Home. And then Medicare, like with home health, Medicare.gov does also provide information about the hospice benefit. And those are good places to learn more. And then also the ALS Association on our website. We do have a 10 things to know about hospice care. And it's just kind of some good general information that you can find and review. And just to look at this a little bit together, as mentioned, hospice is a comfort approach. And the focus of hospice, beyond just the physical care, it's also focusing on your spiritual needs and then emotional support for both you and your family. Hospice is a specialized team, includes a nurse, home health aide, social worker, chaplain. There's a consulting physician or medical director with hospice, and then sometimes there's other disciplines as well. I know some of the hospices offer things like massage therapy and that kind of thing. Third thing to know about hospice, deciding to have hospice care does not mean you are giving up. The focus of your care does change to be more holistic and to help you prepare for your end of life. Again, most hospice care is provided at home, and it can be provided anywhere you call home. So if you live in an assisted living facility or if you're in a nursing facility, hospice can come and take care of you there as well. Your daily care is usually provided by your family and friends, unless you happen to be in a care facility. With hospice, number 5, you do maintain control. You're in charge as the hospice patient, and you determine what your care goals are. You do have the right to revoke hospice if you change your mind. If you decide you don't want to be on hospice anymore, you do always have that right to change your mind and come off of hospice. Sixth thing to know is timing matters. Early hospice intervention can lead to better symptom management and to improved quality of life. And again, your care team can help you decide if and when hospice might be a good option for you. As we discussed, hospice is typically covered by insurance. Number 8, there are some insurance limitations. I mentioned this already, rehabilitative equipment, so that would include the power wheelchair. Certain curative treatments are among care options that are not covered. Um, Whenever you do start considering hospice, they'll come out and do an informational visit for you, and that's a really good time to make sure you understand what kinds of things are and are not covered by whatever hospice you're interviewing, because there may be some differences in, for example, which medications you'll continue to take and that kind of thing. The ninth thing to know is hospice does not hasten death. The emphasis is on quality of life, and it's not looking at treatment to prolong your life, but it doesn't hasten death. And number 10, hospice supports the entire family. Once a person who's on hospice does die, bereavement support is available to the family members for a year after that. So hospice is there for the whole family throughout the journey. The last type of in-home care, the fourth type we're going to talk about today, is non-medical care, which is also commonly referred to as home care. This type of care includes things such as bathing and personal hygiene. It might include things like transfers, mobility assistance around the home, could help with some meal preparation, that kind of thing. And people wonder, when is this care needed? And it's typically needed whenever you are needing more help with your activities of daily living and when you no longer feel like it's safe to be home alone for a long period of time. Those are kind of some of the criteria for when people start to think about having some in-home care. And then it's also can be indicated whenever the care and the household tasks become too much for the primary caregiver. So a lot of times, somebody's being cared for by their spouse, and their spouse may also be doing all of the household management tasks as well. So in those sort of situations, it can be helpful to hire some help. Care can be provided through an agency, or it could be someone that you hire privately, and there's pros and cons to both of those options. Who pays for in-home care or non-medical care? Medicaid and the VA and long-term care insurance policies do sometimes cover part of the cost. Um, Families who don't have coverage under Medicaid, the VA, or who don't have long-term care insurance will typically pay privately out of pocket for in-home care. Medicare and commercial insurance do not cover non-medical care. If you decide to go the route of using an agency, there's certain things to think about. Each company has their own guidelines on staffing. Each company will have a minimum shift and a maximum shift that they have caregivers available. Sometimes they'll have like a 2-hour minimum or a 4-hour minimum, that kind of thing. Sometimes you can get lists of agencies. You could reach out to your local area agency on aging and see if they have a list of these providers. This is also something you can reach out to your local care services staff and see if they have any companies that they've heard of locally. It's a good idea to check reviews online. It's a good idea to ask for references. And also to ask the agency if they're licensed by the state. Many states require home care agencies to be licensed, but not all states do require that. And it's also good to ask if the workers are licensed and insured. Ask how they've been trained. You can ask things like, have they had background checks? That kind of question. And it can be helpful when you're considering agencies to ask for a packet of information from them. That way, you'll have information in writing about their services, about their fees, and then you can also ask for some written references as you're considering which agency you want to use. So you could hire an individual instead of hiring an agency, and there's some pros and cons to both of those. When you're hiring an individual, one pro is it might be less expensive. Another pro is that you're acting as the employer, so you get to make the decisions, so you maintain control. A couple of the cons, um, if your caregiver gets sick or if they have some other schedule conflict, you would have to find alternate help. And then the other con is that you would be responsible for any paperwork. So not only for their paycheck, but also any sort of taxes or if there's any kind of insurance, you'd be responsible for all of that. So those are things to think about with hiring an individual. Some people do have good luck with hiring student helpers. If you're in an area that has a local university where people are studying occupational therapy, physical therapy, or nursing, or any of the health professions, it might be possible to hire students that are connected with that university. And sometimes you can reach out and actually have an advertisement for a student helper. And when you do that, the kinds of things that you would want to share is you'd want to share what kind of help that you need, generally where you're located. If you're comfortable sharing about your diagnosis, you could share that. And then you could share general dates and times you might need help, and then also what hourly rate you would be offering. Also, when you're hiring a student, you might want to discuss any kind of medical equipment that you're currently using. One thing to keep in mind for caregivers, hired caregivers, as well as anyone in your family and friend group, are encouraged to take the ALS Association Caregiver Education course. This is a free online course, and there are different learning modules that go over different ALS symptoms and also common interventions. And it can help your caregiver feel like they understand ALS more and they can have more confidence in providing care for you. And I did list here what the website is, but basically, if you just go to our website, als.org, you can search for the Caregiver Education course, and that is available to anyone. And then I just wanted to share a couple of additional resources for you. I've said this kind of throughout the presentation, but just make sure you're in touch with your local care services staff member. They can help you connect with any resources in your local community. Another option is to contact your local area agency on aging. If you just Google your county and then agency on aging, you can usually find whatever your local agency is. And they vary on what supports they help with caregiving. There is also caregiving information on the AARP website. I listed it here, and then there's even a tab on that website where you can pick local resources and solutions. And one other resource for you is the Family Caregiver Alliance has a tool where you can look up services by your state. And then I listed that here. And as a reminder, the resources will be sent out to everyone that's on this. So just FYI for you. So that's the information I wanted to share with you all about the different types of in-home care. And now I think it's time for questions. I know Lori's been watching the chat and I've kind of seen some things flash by. I didn't see what they were, but I saw that there were things in the chat. So now let's just see what questions people have.
Okay, let me see if I can handle the questions for you, Katie. And go ahead and stop sharing. That way
Mm-hmm.
people can see more of you.
All right.
So there have been some really great questions, and I want to start. There were a bunch around hospice, and so I wanted to help people understand a little bit about what might be included, what might not be included, and really the importance of simply asking uh, the hospice providers. If you've got a hospice provider, ask them now, or if you're considering hospice, ask them. So one question was, should I rent or buy a Hoyer lift, a patient lift, before going on hospice?
Well, the way I would answer that, like if one of my clients asked me that question, um, first of all, your insurance may cover a Hoyer lift directly, even without you being on hospice. And so it's certainly something to ask your doctor about. If you're connected with a neurologist, you can ask them if they could order a Hoyer for you if you're wanting one before you go on hospice or, instead. Um, and then ALS Association does sometimes have lifts available through our loan closet. So you could ask your local person about that as well. Um, and then I don't really know much about renting Hoyer lifts. I do know sometimes locally there's places where you can buy used equipment for a lower cost. And so sometimes people will go that route instead of, dealing with the order and insurance and everything. So those are just some ideas.
Yeah, thank you for that. And in my experience too, I wouldn't I wouldn't go get equipment without talking with both your ALS clinic team and your ALS Association care services person because they're the best connected at getting equipment and hopefully at reducing any cost to you. Other questions around hospice care. You talked about it's it's acceptable to have a feeding tube when you go on to hospice.
Mm-hmm.
And I don't know if you can answer this or if it's by hospice, but there was a question about when my feeding tube needs to be changed out, which is typical feeding tube care.
Mm-hmm.
Do you know, will the nurses do that?
That just depends on the particular hospice. I, I think that would be a good question to ask if you have a feeding tube and you have an information visit with a hospice. I would ask them if they're familiar with changing feeding tubes and that kind of thing. I think it would depend on the provider. Some hospices definitely do manage that, and some may not.
Yeah. So again, ask the folks in your area to help you understand kind of what's available. And if you are working with a hospice or you're considering it, ask those questions that matter to you.
Mhm.
Um, there was another question, and so I want to talk a little bit about types of payment source. There was a question if someone is on hospice and they pass away, will Medicare try to get reimbursement for what they paid for? And so I know that's a challenging question. I wonder if you can address the difference between Medicare and Medicaid, that Medicare doesn't have any kind of payback.
Yeah, in my experience as a social worker, I haven't heard of Medicare trying to recoup any money that was paid out for anything. I wonder if maybe what people have heard of is sometimes people will go through, like an estate planning process to try to get Medicaid, which
Mhm.
is a type of assistance typically through the state that does cover types of care like in-home care and nursing home care. And I have heard that sometimes if you are going through the process to get Medicaid, that there could be something that Medicaid tries to recover after the patient has died. I haven't heard of that with Medicare, and I haven't heard of that at all with hospice.
Agreed, agreed. When people are concerned about estate recovery, it's called, that really is around Medicaid. And so that is state assistance for folks who haven't been able, who have applied for assistance because they've required care that they didn't have insurance for.
Hmm.
Um, Lots of things in the chat. So let me see if I can get organized a little bit. Can I hire a family member to do my care? And so I wonder if you can talk about when people do hire their own, but that who might pay for it. Medicare is not going to pay someone, but there are other programs.
Correct. And in my experience, what I have heard of is that there could be coverage through Medicaid to pay a family member. And it's possible there could be coverage through the Veterans Administration for that as well. I'm not sure, but I feel like those are both possible areas. And for that, I would just check if you're eligible for Medicaid, I would check with whatever your guidelines are for in-home care. And then the same if you're receiving benefits through the VA, I would check with your VA social worker or other VA contact to find out if your family member can be paid. I have not heard of Medicare doing that or any kind of other like private, like commercial insurance.
Correct. Um, I think you mentioned it quickly. Some people do have long-term care insurance. And so if you're accessing long-term care insurance to get more help in your home, you'll likely work with an agency, but some agencies will hire one of your family members if they're able to clear a background check and that sort of thing. So it's not necessarily as easy as saying I want Katie to do my care, but some agencies are happy to have you make a suggestion because sometimes they struggle to find staff anyhow. A couple of, and I'm seeing comments like Will put in that hospice in central New York says they won't help ALS patients anymore. I've not heard that. That's hugely disappointing if that is the case. Anybody in that area that's getting that message, reach out to your clinics and your ALS care services folks because they can advocate for or maybe find agencies you're not aware of. So I'm sorry to read that, Will, but I hope with some resources you can find someone who will. There's a really great question in here about we didn't talk about vent and trach care specifically. And so I wonder if you just, if you're comfortable, Katie, I wonder if you feel like you want to address what would that look like at home?
Mm-hmm. Um, I would say that I don't have a whole lot of information about in-home care with a trach and vent just because I haven't worked with a whole lot of people who are experiencing that. I have worked with some clients. Um, One person, I can just kind of share anecdotally a little
Yeah,
bit. You know, one situation, the person was able to hire private individuals that could go through the training that was needed by a respiratory therapist or by whoever would do that training. Um, I would say that in the Kansas City area, the home care agencies, your options are a little bit limited as far as them having the staff available. But I'm sure there are companies that specialize in that, but it's just not something I know a whole lot about resource-wise. It's definitely something to talk to your respiratory therapist about if they have any resources or other members of your, your medical providers might be able to direct you somewhere.
great. Thanks for taking that challenging question. And um, I do want to share with you that we have a respiratory video series on ALS.org. And we've got there's somebody who interviews different people around respiratory care. And he sits on our board. His name is Ken Menkhaus. And Ken interviewed a couple who have been living at home with trach and vent. He also interviews respiratory therapists and pulmonologists to better understand what vent care at home could look like. And so if that pertains to you, please go to the website and look up respiratory video series. And if you can't get it, email me, Lori McFerrin at als.org, and I will get you that information because information is knowledge. How are you going to make good decisions if you don't have access to that? Now we're going to switch gears a little bit. Patricia asks, under the cons for hiring an individual, when we have the pros and cons, Katie, you said, what does it mean? Or she's asking, what does it mean to be responsible for paperwork?
Uh, I think it just means that there wouldn't be the paperwork that would be done by an agency. So, for example, if somebody's an employee of an agency, that agency would do the taxes and the payroll and that kind of thing. And if you're hiring someone individually, you would do that piece yourself.
Great, thank you. And I'm gonna go back to trach and vent care again for a minute. Ellen writes, in Delaware, the number of facilities that take care of patients having a tracheostomy is extremely limited. Our neurologist strongly recommended not going that route specifically for that reason. And so I would hate for anybody to have to make that decision based on facilities in your state, but Ellen makes a great point. If you, it takes a village to take care of trach needs at home. And most of us live in states where there are very few facilities. I'm in Maine, there are no facilities. So when someone in Maine's needs can't be met at home with a trach, they are going out of state. It sounds like in Delaware, there are very few. I know there are other states in that same situation. So again, talk with your teams early on about whether a tracheostomy is going to make sense for you. And then what would it look like for having care in the home? Because it takes more than just you and a caregiver. But anyhow, hopefully that helps to answer some questions. Again, happy to give the resources on those respiratory videos to anybody who'd like them. I see there are grants available for respite care. Does everyone that apply for those get it? And so I'm not sure, Mike, exactly what respite care grants you're talking about. I know that across the country, grants look very different. So again, you know, I'm on the East Coast. What's available here and respite care is specifically to give your primary caregiver a break. Let's let them get a great nap or go out to the movies and bring someone else in. And so there are, I know agencies on aging and different organizations have different kinds of grants. So I know it sounds a little bit repetitive, but to know what's available in your area, do reach out to your clinic team or your ALS care services person. Do assisted living facilities have staff who are familiar with ALS, the pros and cons of in-home care versus assisted living and then nursing home? How do you feel about tackling that, Katie?
Sure. Well, one thing I'll mention is the ALS Association staff are available to help provide information to assisted living facilities as well as nursing facilities. So keep your local care services staff person in mind for that. Um, I think it really varies how much experience different facilities have with caring for people. Um, as you all know, ALS is a rare disease, and I think it is pretty common to talk to somebody at an assisted living or at a nursing facility where they have not cared for people who have ALS. Um, so it really varies, and I would just ask the different facilities near you if they have experience. And sometimes even when facilities aren't necessarily already experienced, if they're open to reading information and doing those caregiver trainings and that kind of thing, they may end up being able to provide good care for you. So I think that's worth exploring with them.
Thank you. There was a question, and this is a great question and one we all are working on almost daily. It's hard to understand the difference between palliative care and hospice care. And part of the confusion is because we used to refer to them as if they were the same thing. And so, Katie, I wonder if you want to tackle a little bit about the difference.
Mm-hmm. I think one of the differences is that you can receive palliative care as just another component of your care, Whereas when you decide to have hospice care, that becomes the primary source of your care for ALS. So, for example, if you decide to have hospice care for ALS, then they're the ones who um, order your medications, your equipment, that kind of thing. Palliative care is not like that. It's not a comprehensive benefit. It's just another service. So to me, those are some of the big differences between palliative care and hospice care. I think as far as the philosophy of care, they're very similar. I think both focus on symptoms and quality of life. Um, and I do think that the hospice care, at least in my experience in the Kansas City area, is hospice care provides more types of care and more people coming into your home and more frequent visits than palliative care. Those are just some of the differences I've seen.
Yeah. We do have, again, on our website, our webinar series where they're all kind of cataloged. I think it was in January of last year, Dr. Umbreen Mehta did a really great webinar with us about explaining the differences in greater detail between palliative care and hospice care. And she's really committed to just trying to help people understand that. So if you're interested, take a look at that recorded webinar from last January. And I believe that Tamara's going to put the link in if she hasn't already as to where to find those recordings, because palliative care really can start when someone gets a serious diagnosis. Thanks, Tamara. The link is now there. So palliative care is helping folks with serious conditions, whether they're working toward prolonging life and cure, or whether they're just focused on comfort. Hospice care is, in a sense, end of life care, but it's also considered palliative care, but the kind of tail end of palliative care. So a number of you have asked if we can send you this slideshow to you. I don't want to send 200 people a slideshow if they don't necessarily want it. I will send out all of the resources. I see that Will has asked for it, Bruce has asked for it, and I think someone else. So add your name to the chat if you want the slides. Otherwise, the link that Tamara shared with you, that is where you're going to find this webinar and the slides that go with it. Okay, I'm seeing some of you doing that. So go ahead and add your name there. Gosh, there were a couple of other really great questions. I know we're getting low on time, but let me, Katie, there was a question about hospice and meds being covered.
Mm-hmm.
I wonder if you can clarify, because I think they were also asking, well, then can my regular doctor prescribe the ones hospice doesn't cover? So maybe you can shed some light.
Sure. As far as the medications covered on hospice, if you go onto hospice service, then any medications related to ALS would need to be covered as part of your hospice benefit. And so each hospice will determine which medications they cover. So, and that's for things related to your ALS. If you happen to have something else that's unrelated, like a heart issue or something like that, those usually are filled the same way you've always been filling them. It's only the ALS related medications and then symptom management type medications. So treatment for, shortness of breath, for anxiety, for those kinds of symptoms would be part of hospice. And then as far as the drugs that people are on for ALS, that's a really good question to ask when you have an information visit, because that really varies. Locally in Kansas City, we have a hospice that I think will cover maybe two of the medications. Some hospices will only cover one. So that's a good thing to think about, which, if any, ALS medications are you taking and which ones would hospice cover. And your neurologist can't order it separate from hospice because your medications come through that benefit. So they can't prescribe something separately, if that makes sense.
It does. Thank you.
Mm-hmm.
And then another comment in regard to hospice organizations, Karen writes, it's important to note that there may be more than one hospice organization in your area, and the services can be different. And they all have their preferred providers as well. And so you're interviewing for the best care that you can get at a key time in your life. So ask the questions you want. Can you change out my feeding tube? Can I use my same non-invasive ventilation equipment? Do I have to change the source of nutrition that I'm going to use for my feeding tube? Will I see a chaplain regularly if that's important to you? So back to Katie's point about you're in the center, you are in charge. Whether it's an ALS clinic or an ALS organization or a hospice organization, you should determine what's best for you and choose those providers who are going to do what's best for you. So many other great comments, and I see many of you would like the slides, and so I will do that. I just am hesitant to send them to everybody, but I will send the resources to everyone. Anything because we're already at the hour. Katie, anything you want to just kind of summarize or any words of wisdom to wrap up before I close this out?
I think that what we've talked about with just considering what your goals are, what you're needing, and just making that kind of the decision maker in what types of in-home care or other care that you pursue. I think it's just important to get as much information as you can and to feel empowered. And you do have a choice when it comes to all these different providers, whether it's hospice or a home care agency or home health or whoever. And so, just don't be afraid to ask questions and make sure that your goals are being listened to, that your goals are being met.
Katie, I hope you'll take a look at some of the comments. People are saying this was such a great kind of informative service to folks. Katie, like our other care navigators and care managers, really get up every morning so that they can try and help make life easier for families impacted by ALS. So reach out to us, reach out to me in education, reach out to your local folks. And if a couple of you were wondering, do I have local folks? We serve the nation, and so we have folks nearby, if not absolutely locally. So connect with us. We are here for you. We're glad that today's session was really helpful. Katie, thank you. You were awesome. You have a wonderful way at just relaying information in a way that kind of makes sense to us. So
Well,
thank you. Thank everybody who joined today. Thank you, Tamara, for helping us behind the scenes. Before you leave, I want to remind you again of that really quick 3-question survey that should pop up as soon as you close out of today's webinar. The information you give us, like we want information on home care, is what prompts these kinds of conversations. So thank you again, everybody. We will be sending out all kinds of information, and the recordings will be saved probably within the week on the website. Have a great day.
Thanks everyone for coming.